Hi everyone, welcome to another video of Wise Talk with Yvette. In today's video, we shall be discussing about the topic, the difference between nursing in Cameroon and nursing in Germany. And in the next video, which is next week, I'll be talking about the difference between studying nursing in Cameroon and studying nursing in Germany. Actually, I cannot do the two topics in one video because it definitely means the video will be so long and I don't want to bore you with a very long video. So I'll just do this video first with the difference between nursing in Germany and nursing in Cameroon. Actually, the differences between nursing in Germany and Cameroon is because of several factors such as the age population. In Germany, there are more older people than younger people. You have more older people in their 60s, 70s, 80s, 90s. But in Cameroon, we have more youths than the older generation. And also another difference is the culture. The culture of the people here in Germany is different from the culture of people in Cameroon. So let me just go straight to the differences between nursing in Germany and Cameroon. The first difference is in Germany, the nurse is supposed to, and it's the tax of the nurse every day, and it's a must that the nurse is supposed to take care of the bathing of the patient and the feeding of the patient. The patient cannot feed him or herself. The nurse has to help the patient go to the toilet, or if the patient cannot go to the toilet, the nurse has to bring a bedpan to the patient. But the nurse has to care for the body of the patient. This in German we say Körperpflege. I think in English we say the body care of the patient, bathing the patient, rubbing the patient with oil or with lotion, wearing the patient's diapers and pampers. But in Cameroon, it's mostly the family members who actually do the bathing of the patient and the feeding of the patient. Actually, in Cameroon, the nurses are taught, we are taught in the university and in all the other nursing schools how to bathe our patients in bed, like give a bed bath, how to give an assisted bath, and which we do willingly and happily. But the thing is, family members prefer doing the bath of their patients themselves, and family members want to give their patients, their relatives, their bath, or family members who prefer them feeding their relatives themselves instead of allowing a foreign person, which is the nurse, to feed the patient or to feed their family member or give their family member a bath. That's like, I think it's a culture thing where in Cameroon, the family members who instead want to give their patient the bath or the shower. For example, a wife will have her husband in the hospital. The wife will instead prefer coming to visit the husband and giving the patient, wiping the husband with a face towel, or taking him to the toilet, or feeding him, or a daughter wants to feed her father in the hospital when she visits. But in Germany, it's the nurse who is supposed to bathe the patient like every day, give the patient a bedpan. Yeah, it's a must, it's a tax. But I think it's not actually in all hospitals which is being done this way. And the reason is that because here in Germany, they don't want the nurse to be carried away with other activities and forget about the body care of the patient. These are small details which are actually important for the well-being of the patient. They don't want the nurse to forget these tiny details which are important for the well-being of the patient and be carried away with other activities in the hospital. That's the first and important difference which I actually noticed. Yeah, that the family members do more of the body care in Cameroon and the feeding of the patients, but we nurses also do it in Cameroon. I'm not saying we don't do it. We do it, especially patients who don't have anybody who visits them, or don't have so many family members, or a patient who is from a serious operation and needs to be taken care of, or needs to have a bath with professionalism. Then the nurse will tell a family member, no, please let me bathe this patient for today. He's from an operation and I need to do this professionally because we need to do this with so much care. Yeah. Then the second difference between nursing in Cameroon and nursing in Germany is that in Cameroon, the nurse buys her uniform herself. Everyone for himself, God for we all. It's the nurse who is supposed to, if you're employed in the hospital, you're the one who is supposed to go to a tailor or to the market and buy yourself your nursing uniform. But in Germany, we receive the nursing uniform from the hospital. You receive your nursing uniform from the hospital. All you have to do is to buy your shoe. But in Cameroon, the nurse has to buy herself her uniform. Mm-hmm. Then equally, difference between nursing in Cameroon and Germany. Nursing in Germany, when you come to work, you have to touch in with your card. It means 8 hours of work is 8 hours of work. It means you have actually come to work. And when you're going out, you have to touch out. You have to still touch in with your card at one machine to show that you're leaving the hospital. But in Cameroon, I think in all the hospitals which I work in Cameroon, we did not have this type of, should I say, machine where we touch in with our card and touch out with our card. So simply come to work and you go back. Yeah. But I think maybe in the big hospitals which I've surely not been to in Cameroon, maybe they have this touch in system and touch out system. Okay. Then another difference with nursing in Cameroon, nursing in Germany is in Cameroon, in the nursing station. In the nursing station, we don't have a kitchen where there is a microwave or where there is a dishwasher. But in Germany, in the nursing station, the nurses have a kitchen or something, not with some, yeah, let me say a kitchen, or they have a table with chairs. And there in the nursing station, we have a microwave for the nurses. You have the dishwasher for the nurses. Of course, you have the tap and you have the soap and you have the hand sanitizer. Sometimes you even have a gas cooker where you can cook or warm your food. You have a fridge, yes. But you have plates and cups. You have a coffee machine. You have a water heater a water heater, yes, where you can boil your water for tea. You have but in Cameroon, in a nursing station, kitchen inke, okay, dishwasher inke. In Cameroon, the nursing station, there's no dishwasher. Which one is dishwasher? Which one? Why should you be coming to work with your plate and your spoon and your food that you want to come and wash with dishwasher? If you come to work with your plates that you want to eat when you have break, then you wash it with your hand. Yes, there's a tap. Of course, in a nursing station in Cameroon, we obviously have a tap with water and soap. But we don't have the dishwasher in Cameroon in the nursing station. We don't have the microwave, or maybe in the very big hospitals. But even in the very big hospitals, I would say, even in the Chantal Biya hospital, which I did my internship in, or in CHU was in Yaoundé, there was no microwave in the nursing station, or dishwasher. Yeah, I think that's one big difference. Then also the nursing station, in Germany, yeah, there's a good big table and enough chairs for everybody to sit. But I think in Cameroon, we also have in the nursing station, like for example, in the Limbe Regional Hospital, in the surgical ward, yeah, in the surgical ward, we have a table, in the table, and there are chairs around where the nurses too can also sit. Yeah, okay. And then which one is fridge? Fridge for the nurses? No. In Cameroon, we actually don't have nursing station with fridge. It can actually be in the very, very big hospitals which I have not seen or which are still to build. Another difference again with nursing in Cameroon and nursing in Germany. When we are doing the transfer of shift, in some hospitals in Cameroon, during transfer of shift, we have to move from room to each patient, and we do the transfer of shift and talk about the patient. This is patient A, so and so. He has to receive his medicine at this time, at this time. But with nursing in Germany, I've noticed here we don't move from they don't move from room to room of each patient, talking about each patient during the transfer of shift. They simply sit in the nursing station on the round table, and then they do the transfer of shifts from nurse to nurse. The nurse who was in the morning shift talks to the nurse who is coming in the afternoon shift, what he or she has to do about a patient, and the one who has a night shift may also get the information from the nurse in the afternoon shift that this patient has an operation the next day. But in Cameroon, I think because we also want to know our patients too and also identify them physically with their faces, we also go from room to room. But this method of going from room to room in each patient was actually not done in all hospitals in Cameroon, which I was in here. But in most of the hospitals, that's how the transfer of shift was done. Then equally, another difference with nursing in Cameroon and nursing in Germany is that the food the food for the patients actually come from the hospital here in Germany. In Germany, the food the patients receive in the hospital comes from the hospital. More breakfast, lunch, supper. But in Cameroon, the family members have to bring their food for their patients. But there are some hospitals, like for example, the exception of the hospital in Tico, the CDC Cottage Hospital in Tico, actually provides food for its patients. Hey, even the Chantabia Hospital, right? The Chantabia Hospital too. Yeah, so I think in Cameroon, some hospitals provide food for their patients. Not all, but some. Yeah, so it's not really much of a big difference when it comes to food in the hospitals, because I think. Oh, what about CHU? CHU in Yaoundé too also provided food for its patients. So yeah, some hospitals actually in Cameroon also provide food for their patients. Yeah. Okay. Another big difference between nursing in Germany and nursing in Cameroon is nursing in Germany, the nurse is not delegated with so much tasks. For example, we want to do something, they'll say, no, the nurse is not allowed to do that. It's the doctor who's allowed to do that. In some hospitals, the nurse, or in some stations, the nurse is not allowed to put a cannula. She's not allowed to do certain things. Oh, blood transfusion. Like blood transfusion, the nurse is allowed only to hang the blood on the transfusion stand, but you're not allowed to turn it on for it to start dripping. It's the doctor who's allowed to come and start turning it on. But in Cameroon, I feel like the nurses, they have more responsibilities. For example, the nurse is allowed to put granula. Where ASEA is like a comment to make in Cameroon. You go to the hospital and the doctor prescribes a drip for the patient or an infusion for the patient. It's the nurse who's going to put in the granula. Granula is German for cannula. It's the nurse who's going to put in the cannula to give the infusion. And then also blood transfusion. If the doctor has said this patient is supposed to receive so and so amount of blood, the nurse is going to be the person to do the blood administration. She takes with the transfusion stand and does everything, and the blood moves. But here in Germany, the nurse is actually not allowed to do so many things. But when you are working in some stations here in Germany, for example, if you're working in the emergency ward or if you're working in the intensive unit here in Germany, then you're allowed to put the cannula, and you're allowed to surely do I don't know about the blood transfusion, but you're allowed to do more tasks when you're working in certain stations like the emergency ward and the intensive ward. But if you are working in a normal station, like let me just say you're working in the station of people who had diseases, or station of people with kidney diseases, or you're working with in the women's station, gynecology station, then you're just allowed to do certain activities just to care for the patient, like I said in the very first difference, body care of the patient, and give the patient his or her oral tablets. Yes, you can also give the drip set, the infusions, but you're not allowed to put in the cannula. Then in Cameroon, the nurse puts in the cannula. I think even students too. Even students, when I was a student in the university in Cameroon, were also allowed to put in the cannula for patients in the hospital, because that's how you learn. You learn by doing. Yeah, so I think these are just some of the few differences between nursing in Cameroon and nursing in Germany. If I do remember more, I'm going to come and make another part 2 of the video saying more of the differences. But for now, I think I can say these are some of the differences I've noticed between nursing in Cameroon and nursing in Germany. Thank you for watching this video. If you do have another video topic in mind which you want me to talk about or make a video on, please don't hesitate to write it in the comment section below, or you can write it to my email address, whytalkwithYvette@gmail.com, or you can write to me through Facebook or Instagram telling me which topic you want me to talk about. Thank you for watching this video, and see you next time. And please don't forget to subscribe to this YouTube channel, and if you do like this video, please do give it a thumbs up so you can be able to reach many other people. Cheers.